Now let's talk about common communicable diseases. You probably have experienced a fever or stuffy nose or runny nose from a cold. In this lesson, we'll learn about some common communicable diseases, their symptoms, and how they are treated. Most important, we will learn how to reduce the ways of contracting these diseases. So first, let's talk about respiratory infections. The most common communicable diseases are those of the respiratory tract. These infections can occur anywhere from the nose to the alveoli of the lungs. Most are caused by viruses or bacteria. You can reduce your risk of most respiratory illnesses by avoiding close contact with people who are infected, by washing your hands often, keeping your hands away from your eyes and nose, and keeping your immune system healthy. Smoking can contribute to illness by damaging cilia and irritating respiratory passages. In addition, symptoms of these diseases may be more severe in smokers. Smoking has also been shown to suppress the immune system. Then we have the common cold. The common cold is a viral infection that causes inflammation of the mucous membranes that line the nose and throat. Symptoms include runny nose, sneezing, and sore throat. The most common way of getting a cold is by rubbing your eyes or nose after picking up the virus directly through hand-to-hand contact or indirectly by handling a contaminated object. There is no cure for the common cold. Treatment is for the relief of the symptoms, and most colds clear up in a week or so. Often treatment includes the use of analgesics. Use acetaminophen or ibuprofen. Next, let's talk about influenza. Influenza, or the flu, is a viral infection of the respiratory tract. It is most often spread through airborne transmission, but also may spread through direct or indirect contact. Symptoms of the flu include high fever, fatigue, headache, muscle aches, and cough. The flu can lead to pneumonia, which is an infection of the lungs in which the air sacs fill with pus and other liquid. This is a serious disease, is more likely to occur in the elderly and people with lung and heart problems. Antiviral drugs for treatment of the flu are available, but need to be given as soon as the illness arises. Persons who have the flu should get proper nutrition and plenty of rest and fluids. Older adults and persons of any age with chronic health problems should get a flu shot every year. However, anyone who wants to avoid the flu can be given a vaccine. Pneumonia. Along with influenza, pneumonia is one of the top 10 causes of death in the United States. Viral pneumonia is relatively short-lived and produces symptoms similar to those of influenza. Antiviral drugs are used in some cases. Bacterial pneumonia can be treated with antibiotics if diagnosed early. The bacteria that cause pneumonia are often present in healthy throats. When body defenses are weakened, in some way the bacteria can get into the lungs and multiply. For example, if a person is elderly or has influenza, he or she may be more at risk of complications leading to pneumonia. Next, strep throat. Strep throat is a bacterial infection spread by direct contact, often through droplets that are coughed or sneezed into the air. Symptoms of strep throat include a sore throat, fever, and enlarged lymph nodes in the neck. Untreated, strep throat can lead to serious complications, including inflammation of the kidneys and rheumatic fever, which can cause permanent heart damage. Strep throat can be treated with antibiotics. A doctor cannot always diagnose strep by examination. If a sore throat lasts more than 3 days, a culture is taken to identify the bacteria. Next, we have tuberculosis. Tuberculosis, or TB, is a bacterial disease that usually attacks the lungs. TB is spread through the air when a person with the disease coughs or sneezes. Most people who are infected carry the bacteria in their lungs but never develop the disease because the body's defenses prevent the bacteria from multiplying and spreading to others. People with weakened immune systems are more likely to develop the active disease with symptoms that include fatigue, coughing, sometimes coughing up blood, fever, night sweats, and weight loss. People with the active disease can spread TB. Prolonged or repeated exposure is usually required for infection. Some strains have developed resistance to antibiotics. Physicians may have to prescribe several antibiotics at one time until tests are conducted to determine which are effective for a particular person. Next, we're going to talk about hepatitis. Hepatitis is inflammation of the liver that can be caused by chemicals, including drugs and alcohol, and by many different pathogens. The hepatitis A, B, and C viruses are some of the most common diseases of this type of liver damage, and there is no cure for them. However, vaccines for hepatitis A and B are available. Hepatitis A is another one of the top 10 communicable diseases reported in the United States. About 1.5 million people worldwide are newly infected each year. The hepatitis A virus is most commonly spread through contact with feces of an infected person. Infected persons who do not wash their hands properly may contaminate inanimate objects or food or spread the virus through direct contact. Symptoms of hepatitis A are generally mild and may include fever, nausea, vomiting, fatigue, abdominal pain, and jaundice, which is a yellowing of the skin and eyes. Most infected individuals recover completely. Chronic or long-lasting infection is rare. The best way to reduce your risk of hepatitis A is to practice careful hand washing and avoid close contact with people who are infected. We have hepatitis B, which is more serious disease than hepatitis A. Hepatitis B is a virus. HBV is found in mostly body fluids of an infected person, especially blood. It is most often transmitted through sexual contact. It also can be transmitted through needles shared by infected drug users. Though most people who are infected never experience symptoms, the hepatitis B virus frequently causes severe liver damage, including liver failure and cirrhosis, or scarring of the liver. Hepatitis B may be responsible for up to 80% of all cases of liver cancer worldwide. More than 2 billion people worldwide have been infected with hepatitis B. Almost 1.25 million people in the United States have chronic hepatitis B infection. You can reduce your risk of hepatitis B by practicing abstinence from sexual contact and from illegal drug use. Do not share personal items such as toothbrushes and razors, which could have trace amounts of saliva or blood. Body piercing and tattooing using contaminated needles can spread the disease. The CDC recommends that all children and teens receive the hepatitis B vaccine. And then we have hepatitis C, which is the most common chronic bloodline infection in the United States. About 4 million Americans are infected. It is most often transmitted by direct contact with infected blood through contaminated needles shared by drug users. Hepatitis C can lead to chronic liver disease, liver cancer, and liver failure. It is the leading reason for liver transplants in the United States. Up to 90% of those infected with hepatitis C virus don't realize they have the disease until years later when routine tests show that liver damage. You can reduce your risk of hepatitis C by practicing abstinence from illegal drug use. In addition, don't share personal care products such as razors and toothbrushes. As with other viral infections, there is no cure for hepatitis C. Treatment includes rest, proper nutrition, and drinking plenty of fluids. Now let's look at some other diseases. So there's several other communicable diseases that are common among adolescents and adults. So let's look at emerging infections. Some diseases have been effectively controlled with the help of modern technology, such as antibiotics and vaccines. Yet, new diseases such as AIDS and Lyme disease are constantly appearing. Others, such as malaria and tuberculosis, are occurring in forms that are resistant to drug treatments. These diseases are known as emerging diseases. An emerging infection is a communicable disease whose incidence in humans has increased within the past 2 decades or threatens to increase in the near future. Many factors can contribute to the development of emerging infections. One is transport across borders. Infected people and animals carry pathogens from region to region, often to places where those pathogens previously were not a problem. 2 examples of these are the appearance of dengue fever and West Nile virus. Dengue fever is found mostly in South and Central America and parts of Asia, and has appeared in the southwestern United States. West Nile virus appears in Asia, Africa, and Europe, and is now expanding across the Western Hemisphere, including parts of the United States. Both diseases are carried by mosquitoes. Next is population movement. A factor in the increase in Lyme disease is the movement of people into heavily wooded areas where ticks are prevalent. Symptoms include rash, fatigue, fever, headache, stiff neck, sore muscles, and joint pain. Lyme disease can be treated with antibiotics. We have resistance to antibiotics. The widespread use of antibiotics has resulted in pathogens that have become resistant. The pathogens that cause tuberculosis, gonorrhea, which is a sexually transmitted disease, and a type of pneumonia all have developed resistance to one or more antibiotics. Another factor is changes in food technology. Mass production and distribution of food increases the chance that contaminated food will infect a greater number of people. E. coli has been responsible for outbreaks affecting thousands. Then we also have agents of bioterrorism. Because of the ease and frequency of travel, a contagious bioterrorist agent such as smallpox can spread rapidly from country to country. Public health officials in the United States are addressing infectious diseases elsewhere in the world because pathogens can emerge in one region and spread. Information on emerging diseases is widely available on the internet, in books and magazines, and also through news reports. With health information readily available, individuals can become more proactive and responsible for reducing their risk of communicable diseases, including emerging infections.